So today we're going to be talking about upper cervical chiropractic and how it's a little bit different than what you might think of traditional chiropractic. First, a little bit about me. My name is Vanessa Wulff, and I graduated from Chiropractic College, Life West in 2012 with honors and the Clinical Excellence Award. I did a residency in Nucca for about a year in San Francisco, and I'm happy to be back in the East Bay practicing Nucca in Dublin. And I love to work with patients of all ages from birth all the way into the 90s. First, let's start with a little overview of the spine. There are three major areas of the spine: the neck, which is called the cervical spine, the mid-back, the thoracic spine, the low back, which is comprised of the lumbar and sacral spine. The upper cervical chiropractic focuses right on that top part of your spine, and it's called the upper cervical spine because it's the top two vertebrae. Let's take a closer look. So that first cervical vertebra is called the atlas, the second one the axis, and right in between there lies your brainstem. So this is a very important part of your spine. It's the most freely movable part of your spine, which is great because you can move your head around and look. And then because it's so movable, it's also the most vulnerable to injury. So any injury to the spine or body can misalign this top part of your spine, and therefore it affects the brainstem. A misalignment of the spine is called a subluxation, which is just that fancy word for misalignment. But a subluxation of the upper cervical spine, that top part of your neck, can put direct pressure right on your brainstem. Here's a cross section. Looking right in there, there's your brain and your spinal cord. So any misalignment will put pressure there. Here's the nervous system. So you have your brain, which controls everything, the brainstem, which is the conduit between everything, and also your spinal cord, which lets all those messages go out to the rest of your body. This system controls every single cell, organ, muscle in your body, so we want it to be working correctly. So how would you know if you do have an upper cervical subluxation, that misalignment in the top part of your spine? Well, first we would take a history, see if you have any symptoms, any pain, weaknesses, numbness, tingling. And then most importantly, we do a physical exam. See if you do have any weak muscles indicating your nervous system is not working correctly. And most importantly, we check your posture. What happens is if you have that upper cervical misalignment, some muscles will spasm, and that can create an unbalanced posture. We'll often see the ears are at different heights, the shoulders, and the hips, and that can result in looking like you have a short leg. If we see that, we'll take some Nucca X-Rays. We take 3 views, one from the side, from the front, and from the very top, so we can get a full picture of that misalignment of the top part of the spine. That one from the front lets me see if that bone is really out of place from one side to the other, also how the head relates to the neck. When we take the view from the top, we see if that top bone is rotated at all, putting that direct pressure on the brainstem. We're able to calculate a 3-dimensional misalignment from those 2 X-rays, and we can see exactly how much pressure is being put on your brainstem. Because we're so specific, Nucca is very gentle. When we calculate that misalignment, I can do a gentle correction with no popping, twisting, or cracking. The patient simply lies on your side and will gently and specifically tap that bone back into place. And we instantly see changes after that correction. We'll see that the posture evens out, taking pressure off the spine, which can help with symptoms. We restore those normal biomechanics, and your nervous system will start working correctly. And we can increase the stability in your spine so that you don't have to come back for visits twice a week forever. You actually start to stabilize your spine. So if you think you might have an upper cervical misalignment, call today for your free consultation with Dr. Wulff.